Good evening, everybody.
Good evening.
Good evening.
Hey, Dr. Smith.
Good evening. Good evening, City of Wilmington. This is Councilman Yolanda McCoy, and I'm glad that you're able to join us for the Education, Youth, and Family Committee meeting. This is our very first meeting this year and this term, and I would like to start by having all my colleagues introduce themselves. We can go in ascending order.
My name is Linda Gray, 1st District, and I'm Vice Chair. Thank you.
Jill Harley, 4th District.
Sinead Darby, 2nd District.
Regina Fields, 5th District.
Okay. I'm sorry, I thought I saw someone else on here. Okay. I said, well, thank you so much. Is that Councilman Spadola? Is he joining us?
Yes, I'm sorry. I didn't know if you just wanted the committee members, but yes. Thank you, Madam Chair. I'm James Spadola, City Council at Large.
Okay, so thank you very much. And as I said, I am Yolanda McCoy. I am the 6th District Council person, and I am the committee chair. So this evening, we will be joining you virtual again, through a virtual meeting, and we would like to start by making certain, we would like to start by doing the agenda. On our agenda, we have one presentation.
Just hold on.
Okay. On our agenda, we have one presentation from the Wilmington Community Advisory Council. Is there anyone that would like to come and make that presentation?
Oh, I thought they were inside.
Okay, so I do see some members, but I don't hear anyone actually speaking. Oh, I would like to also recognize our council president, Mr. Trippiconga.
Thank you.
And Madam President, Mr. Henry Smith and Gwen Aguilette is also on for the presentation.
Okay. Thank you so much. I did recognize Dr. Angelette. So if she would like to begin the presentation, I welcome it.
Well, actually, I'm going to turn to our chair, Dr. Henry Smith. He is going to lead us this evening in the presentation, and I am here to provide support.
Okay, thank you.
Thank you, Dr. Angelette. There are two documents that I provided to the council for this brief report that I will be offering. One part of the report is a brief summary of some of the achievements of the Wilmington Community Advisory Council over the past 4 years of its existence. And the other provides a sense of the things that we wish to continue to work on this year and into the future. I believe this is my fifth encounter, with members of the Wilmington City Council. My first goes back at least a couple of years ago, I believe, when I had the privilege of meeting with the full council. And I believe that same year met with the Education, Youth and Families Committee when it was being chaired by Council Member Harley. I was there for another organization, the Freedom School. But last fall, we also had occasion to meet with the Community Development and Urban Planning Committee of the Wilmington City Council. And then most recently had an introductory meeting with Council President Congo, who's coming in with the Council's Chief of Staff, Daniel Walker, and Ms. Bashnight, who is, I believe, the Chief Fiscal Officer for the Wilmington City Council. So this will be my fifth encounter with the council. And as I said, I feel a sense of privilege in having had the opportunity to meet with the full council and members of various committees and individuals over time to talk about issues which I believe are of common interest to us. Tonight, I'll be focusing on the Wilmington Community Advisory Council. And so if I could have someone just pull that slide up again, that infographic that provides a brief summary of some of the things that we have accomplished over the past 4 years. And a number of more important things are going to be in the follow-up presentation looking forward. As you can see, the very first item that we have in terms of accomplishments has to do with this work around trauma-informed practice. And this became for us a priority right out of the gate. Because as we were engaged in starting this work back in the fall of 2016, our research pointed out that the children of Wilmington, that more than 60% of our children had experienced some form of trauma in their lives. Our children were really, really hurting. And it was our belief and remains our belief that to continue to work on behalf of these children, a priority must be dealing with these issues of trauma. And so early on, we worked with Terry Lawler. Terry Lawler is a behavioral health specialist and providing training to over 140 individuals in trauma-informed practice. And these individuals came from some 20 organizations across the city of Wilmington. We also were involved in training of certified trainers to build future trauma-informed practice capacity. That is a train the trainer initiative, so that this work could continue beyond what the Wilmington Community Advisory Council could do directly, because this is an important area of work. We also developed the Early Intervention and Service Referral Guide to drive community-based behavioral support for youth in need. And then we were involved with this Take Care Delaware initiative, launched where police notify schools of children who need support. We believe that the pilot effort was at a school in Smyrna. So those are some of the things that we did with regard to addressing behavioral health issues for our children in the city of Wilmington. The other thing that we were involved in is work with community organizations and community coalitions. The Wilmington Community Advisory Council does not operate any programs on its own. What we do is we advocate for and we try to identify support for community organizations in the city of Wilmington that can engage in work that would improve the life chances of children in Wilmington, and particularly those children most predisposed to violence, either as victims or as perpetrators. And in that regard, one of the initial initiatives of the Wilmington Community Advisory Council and a work that's still ongoing is this CIT, the Community Intervention Team. Some of you, I'm sure, know Darrell Chambers. And if you know him well, we call him Wolfie. And this is a guy who has committed his life to working with young people in high need areas around trying to prevent them from engaging in violence. But this is an initiative that grew out of the Wilmington Community Advisory Council. Another initiative that grew out of the Wilmington Community Advisory Council, but one in which we were involved, and that is the Cpsu, or the Community Partner Support Unit. This is a unit within the Division of Social Services. And this was an effort to try to work with state agencies to transform the way those agencies engage individuals in the community. The CPS unit is a critical link between the services provided by the Division of Social Services and the needs of individuals who qualify for those services, but have varying challenges in terms of connecting with those services. And so we were fortunate to have had the opportunity to work with the Division of Social Services in getting that started. We also were engaged in successfully advocating for support for 6 of our partner organizations to receive funding from the Partnership for Healthy Communities. That's an organization that operates under the aegis of the University of Delaware. My former boss heads it up, Rita Landgraf, who is our former secretary of the Department of Health and Social Services. It's an organization that does very important work all across the city of Wilmington. And so we were able to advocate for some support for 6 of our partner organizations to be funded, or at least receive some funding from that organization. The other area of work had to do with policy advocacy. And policy advocacy for us were in 2 areas, education and criminal justice reform, but particularly criminal justice reform related to juvenile justice issues, because we are focused on youth. 4 of the bills that we supported going back 2 years now were passed. This past calendar 2020, the General Assembly did not meet, and that really slowed down the work that we wanted to engage in with regard to the policy. But we are once again engaged in that through another partnership that I'll talk about a little bit later. Well, it's just this organization that's coming up right now. This Racial Justice Collaborative. This is an organization that the Wilmington Community Advisory Council, in partnership with United Way, established this past summer, late spring, early summer of 2020. And it grew out of frustrations that many of us share regarding the following the public assassination of George Floyd. And we also had George Floyd's assassination preceded by some others. And those incidents were impetus, if you will, for the establishment of this Racial Justice Collaborative, which consists of over 200 people across the state of Delaware, all 3 counties, at least 150 different organizations. We are involved in 7 areas of work, and I can get into that if we would like. And but that's a new initiative that we are involved in. Another initiative that we became involved in last March is the work that we're doing with regard to COVID-19. The Wilmington Community Advisory Council was approached by representatives from the Department of Health and Social Services and the Partnership for Healthy Communities this past March, asking us to utilize our network of partners and working to ameliorate the ravages of COVID-19 on Black and Brown communities in the city of Wilmington. And we established this COVID-19 mobilization group, which now meets every Wednesday from 11 to 12. I believe all of you as members of the Wilmington City Council receive our reports. And of course, you've got an open invitation to join us at any of those meetings, any Wednesday, again, between 11 and 12 every Wednesday. And so you definitely have an open invitation to come at any point and join us in that. But that's work that we feel has had a lot of success. And we're going to be moving very heavily into work with trying to encourage greater involvement of the Black and Brown community in the vaccination. Given the history of our people, with what's happening, what has happened historically with regard to public health issues, we are experiencing a lot of resistance, and we really need to have that resistance overcome. COVID-19 is, as my son would say, nothing to mess with. It's really, really serious stuff. And so we really want to work to encourage more individuals to get the test, but equally significant is to get the vaccination. I received my first vaccination today, and I'll be getting a follow-up on the 24th of next month with the second shot. We've also been involved with youth engagement and employment, particularly through the safe havens. The safe havens were initially established by the Children's Department, and they've been around for a while, but we've been working to expand opportunities for more youth to participate in safe havens. And as you can see from this bottom row, that we've done some good work going back to 2017 up through now. And then we've also worked very closely with the Wilmington City Department of Parks and Recreation with regard to youth employment. I'll talk a little bit later about this grant that we recently received. The city actually got it, and got it through a partnership. The city got it through a partnership that we had established with the Criminal Justice Council to get this $1 million grant over a 5-year period to continue to work with young people in the city of Wilmington. So that's a broad summary of some of the stuff that we've done over the past 4 years. And if we could go to the PowerPoint slide, if you allow me, then I'll be open to to questions. Talk a little bit about some things that we've got on the horizon.
Okay, Mr. Smith, if you wouldn't mind, I
Yeah.
just want to make certain that you just gave us a lot of information. I want to see whether any of my council members, the committee had any questions.
Oh, okay.
So is everyone fine so far?
No.
Okay, Councilman
No.
Gray.
Yes, I have quite a few questions, so I don't know. Let me just start here. Well, one, something of great interest to me is the vaccine distribution. And it was brought up that we're having resistance in the community, but I'm not aware of where we have really offered it in large scale to the Black and Brown community in Wilmington. I have heard about Dover and Middletown, but I've not heard it being offered en masse in Wilmington. So if you're involved in this initiative and you would like more Black and Brown people to get the vaccine, how can we get it? I'm in the age group where I should be able to get it, and I can't seem to find any place that I can get the shot. So I think it would be a good.
I'm sorry, Councilmember Gray, you hit on probably the most critical point for us right now with regard to the vaccine. It's not the resistance issue right now, it's the availability issue. Mm-hmm. And that is an issue across the country. Delaware, as all states across the country, are way behind in terms of what we had anticipated to be the supply of vaccines in the state.
Go ahead.
I'm sorry, go ahead.
Sorry, go ahead.
No, they were commitments made by the previous administration about the availability of vaccines. And you may have heard on the news recently where President Biden pointed out that what his administration had expected in terms of an inventory of vaccines just wasn't there. And we are now experiencing that. And so you're absolutely correct. even as we try to work with individuals in overcoming the resistance, right now we don't have nearly as much vaccines as we should have and need to have to address even the needs of those who are not resistant to getting the vaccine.
Thank you. But that's what I was addressing, that to break down the resistance, we need to have it. And maybe council members who are willing, since we are Black and brown, could be an example of getting vaccinated. Especially since Wilmington has the largest Black and brown population in the state. They're giving mass vaccinations in other parts of the state. So I understand there's a shortage, but I'm just wondering why we have not had mass distribution in Wilmington, where the Black and brown population has been hit the hardest, other than maybe the farm workers in Sussex. I understand that. So that's my question, but thank you.
Okay, Councilwoman Gray, thank you so much for your question. Did you have a follow-up, or can we have Mr. Smith continue?
Well, I have some other questions about the trauma training. Who did the initial training for the trauma people that you trained, the 140 and then the 55?
I'll refer that to Dr. Angela.
Yes, just make sure I'm not on.
Yeah, we can hear you.
Thank you. Terry Lawler, who is a clinical psychologist. She was formerly with the Red Clay School District. She's now in charge of trauma-informed practice and social emotional learning for the Department of Education. She developed the curriculum especially for us. And what's really special about this is it parallels the training that had been done in the schools, that she has coordinated in the schools across the state. So there's a real relationship between what the representatives from the community-based organizations are receiving and what teachers and staff and schools are receiving. And the idea is that if we have a common language between the community and the schools around trauma-informed practice, we have a better shot of providing that supportive environment for our young people and getting them into other services if they need additional support. And Dr. Smith will talk a little bit more about a grant that Terry got to support those increased services to our children and our young people.
Thank you. May I continue, Madam President? Madam Chair, sorry.
Yeah, actually, I do have another council person that would like a question. Would you mind holding that question?
Oh, no problem at all.
Thank you. Councilwoman Harley, you had a question?
Oh, thank you, Madam Chair. If I may, I was going to just respond to Councilmember Gray's question regarding the vaccination. I do have some information regarding a phone number and an email address where you can call or email and put your name on the waiting list to get the vaccine.
Yes, thanks for that. For those who may not have the link, we could certainly provide that. That's through the Division of Public Health. They've got a COVID-19 link that provides information as to how you can register to receive the vaccine. They're going through 4 phases for distribution of the vaccine as the vaccine becomes available. Phase 1 are 2 parts. All of those Phase 1A, all of those frontline workers and individuals who are working in nursing homes and the like. And then there are folks who are involved in places like the education arena. That's 1A and 1B. Then there's a phase, 1B would be folks like myself, anybody, I don't think there's anybody in this panel except Dr. Angela and I who are in this category. Those 65.
I am.
No, it's a category, those 65 and older.
I'm in that category.
Oh, well.
Well into it.
Thank you.
Okay.
Excuse me, Madam Chair. I just wanted to be acknowledged. I'm not able to raise my hand over here. Something's going on, but I just wanted to be acknowledged that I'm present. I'm sorry.
Thank you. Thank you so much, Councilwoman Oliver. Please acknowledge that Councilwoman Oliver is present at this meeting.
If I could also mention one other thing. The Division of Public Health right now is essentially working on setting up mass distribution sites and smaller sites for people over 65.
Look at her food.
All of you are on the email distribution that I send out, and like this past Sunday, I got notice that there was going to be a vaccination event at Del Tech at the Wilmington campus. It came up like out of nowhere. As soon as I got it, I shipped it out. So there'll be these kinds of events that are coming up. There'll be more of them. So I would really, when you see an email from Gwen Angelette and it says COVID-19 on it, there's, if you were looking for the latest information about what's happening with COVID in the city, those emails, I'm trying to provide that as timely as I possibly can. Same thing is true around testing, knowing where the testing sites. And I know Councilwoman McCoy has asked me from time to time about wanting more testing in her particular district, and we certainly did work on that. And we've done it, tried to do it and respond to needs, because you are on the ground, you are seeing what the needs are in your districts. And so that information is really helpful to us in kind of informing our advocacy around getting testing where it needs to be, and ultimately where we get the vaccine where it needs to be.
Thank you so much, Dr. Angelette. Councilwoman Fields, did you have a question?
Yes, hi. Thank you, Madam Chair. My question to you is, there seems to be some difficulties when the seniors are calling in or they're calling in or going on the website. They can't get through. Are you seeing a lot of that?
We are, and that was part of the subject of our call today. And public health is working on that. I think they're looking at having some alternate lines set up so that they can handle more volume, through those call centers, because we realize that not every senior is going to be comfortable going on the internet and going in and going through the process of registering online and so forth. So we're doing a lot to try to figure out what can we do to make this more accessible to seniors, having better call-in numbers, more of them, having people in their neighborhoods that are reaching out to them. Those are all the kinds of things that we're working on right now. And we're trying to get those set up as quickly as we possibly can.
Okay, so just tell them to keep calling until they can get through.
Unfortunately, yes. I had a lady from Southbridge call me yesterday and asked me if I could help her get signed up for testing, for a vaccine. And I did, because, everybody counts. Everybody we can help.
There's something else that
Thank
we are
you.
beginning to.
I'm sorry, Mr. Smith. Dr. Angelette, were you finished?
Yes, I am. Thank you.
Okay, thank you. And Mr. Smith, could you please continue?
Yes, just real quick. There's something else that we're working on. We recognize that in Wilmington and elsewhere across Newcastle County and the state, there are what we call tech deserts, or places where folks have got real challenges associated with transportation, public transportation or private transportation. And we need to get more people out into the field to be in touch with those individuals, not just to encourage them to get the vaccination, but how do you get them registered for the vaccination, scheduled for the vaccination. We can't rely on technology to do that, because they are places where those folks experience significant challenges with regard to the technology. So we're working through that right now with St. Francis Hospital, the United Way, and some of our other partners.
Thank you so much, Mr. Smith.
Council Chair, Chair.
Yes, I'm sorry, Councilman Aller. I know your hands are not able to raise.
I'm sorry. I just want to now just see what Councilwoman Harley put that up. I thank you, because I did have it, but that was good. Just put that on the chat. But I wanted to mention that they had lines of people, because I took 3 people over to Salesiana who was 65 and over, and the line was around the block last week. So it is some places in Wilmington. I just know Salesiana was giving it out, and I had 2 people text me and said they went down to Christiana Hospital and must have took the vaccination. And I did see where I didn't ask Loretta. I seen Councilwoman Loretta Walsh. I put it on her Facebook that she took the vaccination. So it is some places, but I just said congratulations. But so it just lets me know it is some places here in Wilmington that are offering the vaccine. And as Dr. Henry said, and Councilwoman Harley, and I don't know if I missed something because I was having problems getting on, it's under the public health, and it's up to us just to read up on some of that stuff, because it is here. I just, like you said, just certain places. It's probably not as prevalent like it should be, but just looking at the news, it looks like it's a shortage all over the United States with the vaccination. So it's not just here in Wilmington. I wanted to say that. And I want to thank Dr. Henry and Dr. Gwynn for the outstanding work that you do. I just receive a lot of emails from y'all, and I hear a lot of good stuff about you. So y'all kind of keep me updated, because when I want to hear something that's going on, I look and I receive an email. I'm like, oh, they're on it, Oh, okay. About COVID-19 and other traumas that are occurring in our community. So I know y'all get beat up a lot by various people. I mean, I don't mean council members, I'm saying in general, but talking to Mr. Chambers and Bobby Cummins and some people that work in the health department, y'all are highly regarded. And I just wanted to give kudos to y'all, and I'm done. Thank you.
Thank you.
All right, thank you, Councilman Oliver. Councilwoman Gray, you had your hand up?
I'm going to put to bed the vaccine. Thank everyone for the advice. I'm on at least 4 lists. I knew about Sally's, I knew about Del Tech and Christiana, but they didn't have any appointments left when I applied. But I'm on every list that I know of. But thank everyone for the advice. My other question was the people that were trained for the trauma, where are they working? Where are they reaching out to the trauma-laden kids? I mean, are they in the schools, or are they working? I'm just at the community centers. Where are the people working that were trained?
Well, they are working at community centers, and we like all of us, we had to pivot when COVID hit, and so some of the in-person work had to change, if you will. But when the community centers started being able to open up again or serve more children, that's where it's happening, because we train primarily folks in community centers, but we also train folks in Boys and Girls Clubs and other similar, the PAL. I mean, there was just a wide array of different groups that were. And the idea was that they would train people in their organizations, and then they could also host working sessions for community members. And we're going to talk about an initiative in just a couple of minutes when Dr. Smith resumes, that'll give you a little more information about that.
Thank you very much.
All right, thank you so much, Dr. Angelette, Councilman Gray. I have one more question for Councilwoman Darby.
Yes, good evening. Thank you guys for this presentation. This has been wonderful, great information. I had a question about, in regards to the trauma-informed piece. I know our state declared that we're a trauma-informed state. Have you guys thought of promoting or implementing or collaborating with trauma-informed therapists, like mobile therapists? So the type of work that I do, like my real job, I remember I got a real job too. So like my real job is working with children. I'm a trauma-informed therapist, so I work with children, and I do virtual appointments now. But beforehand, I was going into the community. So I would pick them up from home, and our session would be at the Children's Museum, right? Or our session would be at McDonald's or wherever it would be, or I would go to their school and I would go into the home and I would do family sessions with the family. Is that something that you guys, have you been working with different therapists, mental health counselors on that initiative?
We work closely with, as I mentioned, Terry Lawler. There is an initiative called Project Thrive, where therapists can enroll to be a part of their provider network. And those therapists can be reimbursed for services that they provide to children, in schools or in community centers, based on referrals that are coming from those organizations. And I can connect you with Dr. Lawler, to learn more about that. But to answer your point, the idea with the trauma training in an organization is that to try to help that organization to really embrace trauma-informed practice across their operation, but also to identify when children need more help, and then to be able to connect them to community resources, like you mentioned, for that additional help. So the training includes a list of referral sources. So if you are part of a provider network through the state or through the Department of Education or something like that, you would be well positioned, to be connected into, those, to receive those referrals, if you will, as another source of being able to reach out and help the children that really need it. And this other initiative that we're going to talk about in just a couple of minutes will be another way to make that connection. So I'm happy to know that that's some of the work that you're doing in the community. That's really helpful.
Okay, did you have a follow-up, Councilman Darby, or can we get on to the other slide?
We can go to the next slide. Thank you, guys.
Okay. All right, Dr. Smith, if you wouldn't mind, you can proceed.
Okay, I don't know who is working the Zoom. I would like for the, okay, great, here we go. Can we put that in slideshow mode? Yeah, thank you. Okay, I'm gonna talk now about some things that we've got on our list of, our to-do list, if you will, going forward. But this presentation also talks about a little bit more about some things that we've been engaged in. If you go to the next slide, Madam Chair, you had asked for a list of the board of directors for the Wilmington Community Advisory Council.
Yes.
Just like to point out that last spring, Dr. Angelette and I started working on making the Wilmington Community Advisory Council a 501c3 organization, and we received that status just recently from the IRS. And part of that, becoming a 501c3 is the need for the establishment of a board of directors. And right now we've got these 7 members are on our board of directors. We're also looking to recruit immediately 2 additional individuals, and we have a particular interest in young people. And so really, if you know of young people who might be interested in joining this board, please let us know. But these are the 7 folks right now who are on the board, and you've got email addresses for them. If you go to the next slide, I'll start talking about some things that that we are involved in. We continue to be involved in working with our community partners, including youth serving organizations, our community coalitions, and grassroots groups. As I indicated earlier, these organizations constitute the means by which the goals of this collaborative, the Wilmington Community Advisory Council, is achieved. So our work will continue with those organizations. If we go to the next slide. Also talked about this work that we've been doing with the COVID-19 mobilization group. Shortly after COVID-19 was recognized as a serious crisis back in March of last year, the Wilmington Community Advisory Council was contacted by a representative from the state's Department of Health and Social Services and the University of Delaware's Partnership for Healthy Communities. And they asked us to head up on their effort to ameliorate the disproportionate, ravaging impact of COVID-19 on Black and Brown communities in Wilmington. So by utilizing our extensive network of partners, we were called upon to mobilize and align efforts for communication, outreach, screening, testing, and now vaccination adoption and compliance with the CDC and state guidelines. This work has now been expanded. We started out with a focus just on the city of Wilmington, but this work is now expanded to include similar efforts all across all of Newcastle County through a partnership that involves state agencies such as the Division of Public Health, DEMA, and the city of Wilmington, Newcastle County government, and community organizations throughout the city. Some may ask, how does this work align with our work on violence prevention? And I would answer this way, that violence in our community is driven a lot by the social determinants of health, including education, income disparities, access to safe and affordable housing, and the like. And so the gaps in these social determinants in the Black and Brown communities became more apparent with the onset of COVID-19. So with our previous experience in building community capacity to address violence, it was a natural pivot for us to focus energy on addressing the impacts of the pandemic on our most vulnerable communities. We go to the next slide. If we go to the next slide. Is someone doing the, oh, I'm sorry. Okay, this is the next slide. My apologies. I mentioned to you earlier, about our work in trying to address systemic racism. In the late spring of 2020, following this public execution of George Floyd, the WCAC entered into a partnership with United Way of Delaware and the establishment of what we now call the Racial Justice Collaborative, RJC. The collaborative includes more than 200 leaders and still counting from grassroots, civic, and nonprofit organizations throughout Delaware. Its strategic objective is to drive transformative gains in racial equity and social justice across Delaware by eliminating those government, corporate, and social policies and practices that enable systemic racism and replacing those with those policies that achieve and sustain equitable opportunities and outcomes for all of our people. We are focusing on 7 pillars, if you will. They include education, wealth creation, criminal justice reform, diversity and inclusion, policy changes, youth development, health, and all of these 7 pillars are going to be supported through the establishment of a social justice fund that we have established. The next slide, please. We believe that to best manage what we do, we must better measure what we do. Thus, we will continue to work with Dr. Dorothy Dillard from Delaware State University to improve our approach to performance measurement and evaluation. This is, of course, contingent on having adequate resources to support that engagement. But this is something we've been working on, now for well over a year. We've got to really fine tune, how we measure the impact of what we do. Next slide, please. We also want to continue to enhance communications and our sustainability efforts. And this will include providing communication support to promote more awareness of the council's work with community partners and messages related to the purpose of this scope. And we want to engage more substantively in research and development of grant applications to secure funding to support our operations now that we are a 501c3 organization. Next slide, please. This is a part of our story that's really been underreported. We haven't talked too much about this, but I know that my dear mother, who I lost back in 2014, one of her favorite citations from the scriptures was this: may the work I've done speak for me. And this slide presents some of the work that we've been engaged in. We've mentioned the work around the trauma-informed work that we've been engaged in. And we were in partnership with our partner at the Delaware Department of Education in bringing the $7.5 million grant from the U.S. Department of Education that's now enhancing the provision of trauma-informed behavioral health services across the state. We also, the city also received notice just this past fall of $1 million grant from the U.S. Department of Justice to the Criminal Justice Council. And those funds, that $1 million is available over the next 5 years for youth employment and leadership development that will be conducted by the City Department of Parks and Recreation in partnership with the Wilmington Community Advisory Council. I've mentioned earlier the $370,000 that we've gotten from the Delaware Partnership for Healthy Communities to support some of our partners. We recently received $40,000 from Newcastle County for our work, to support our work with the COVID-19 community mobilization efforts. We got a small grant from Delaware State University to partner with them with regard to a study involving community residents, particularly in the Black and Brown community, about how they make choices relative to responding to the COVID-19 pandemic. And then we were recently engaged in working with, this is a very, very important organization here in the city, this Network Connect. The 2 young ladies who run it, they're just absolutely fantastic. And I do believe that this grant application was funded. Mm-hmm. But I want to talk a little bit about our newest project, if you will. If we go to the next slide. Again, this behavioral health stuff was where we started And right now we're engaged in a pretty substantive initiative in this area. So the major ongoing interest of the state's Division of Substance Abuse and Mental Health, DSAM, is improving its behavioral health services and delivery system. Consequently, it has been working with a well-established organization called Health Management Associates, HMA, on a behavioral health model that it will roll out as a pilot. About a year ago, the Wilmington Community Advisory Council was asked to be a participant. In turn, following our practice of supporting community partners that are most proximate to the affected population, the Wilmington Community Advisory Council invited Network Connect, that's the organization I just mentioned, and the Community Intervention Team, CIT, to join in this partnership. These two organizations were actively involved in designing the project and will manage its implementation. In turn, they will be provided a budget of roughly $1.4 million, which will in turn enable them to employ 29 individuals here in the city of Wilmington with an annual payroll of about $1.3 million. They will also partner with 6 host community sites. These are community organizations in the city of Wilmington. And they will be providing one-on-one support to youth and families who are facing life challenges and developing coping strategies and making connections to behavioral health and other community resources. As I said, this is a point where we started. It's where we feel is a need to continue the work around behavioral health. Our children are experiencing, not just our children, but our children and many of our partners here in the city of Wilmington are experiencing untreated, trauma and the related behavioral health issues that attend. And so this is a major investment that we've been working on now for the past year. It's about to be come to fruition. And as we've done, is not to put the work under the in the Wilmington Community Advisory Council, but we are supporting 2 partner organizations that will in turn be working with 6 community organizations that will house, if you will, the 24 community well-being ambassadors. There'll be 2 individuals who will be serving as coordinators. And then, of course, there are the 3 individuals in the partnership, 2 from Network Connect, and then, of course, Darrell from CIT. This is the newest initiative for us, and it's one in which that we have tremendous pride. And then finally, let me go to this next slide, if you will. That's fine. In addition to the more glamorous work that I just described, there is the less glamorous but absolutely essential work that must be done as the backbone organization for collective impact and addressing violence prevention. That's the stuff that we do in the background. And those things include what you see on this slide and these 4 bullets. We will continue to support the engagement of youth to ensure that they have an active voice and are partners in the work of the WCAC. We will continue to serve as liaison with other state and local government entities, such as this one. We will continue to provide the nuts and bolts staff support for all meetings of the WCAC and its working groups, including planning, recording, and following up on actions to be taken. And we will provide support to the newly established board of directors of the now 501c3 Wilmington Community Advisory Council. So these are the things that we have in our inboxes, if you will, going forward. And so that concludes my presentation, and we are available to answer additional questions that you may have. But once again, I want to thank you for this time.
Thank you so much, Dr. Smith. I do see that we have a hand up, but I did have a question before I get to that, Councilwoman. My question actually had 2. Would you be able to summarize kind of the 4 bills, those policies that you worked on, even just the title, so we can have an understanding of the bills that were passed?
We will send you a complete report on that.
Okay, great. And then also you made mention of quite a few different places where grants or funds have been received. With all of the help that you actually did with the state when it came to using your collective to try to bring information and get people to be tested for COVID, was there any funds received from the state of Delaware?
For COVID-19, no, there was more in-kind support as opposed to dollars. The only dollars that we've gotten for our work with COVID-19 is the $40,000 that's come from Newcastle County.
Mhm.
The state has provided, as I said, in-kind support from the Division of Public Health, in-kind support from DEMA, that's a Delaware,
Emergency Management Agency.
Emergency Management Agency, I'm sorry, DEMA has provided support. We've had support out of the governor's office with regard to communication. Then we've gotten lots of support from staff from Newcastle County, but that's been in kind. The support, for example, that come from myself and Dr. Angelette, it's also in kind support. We don't get paid for the work we do with COVID-19. So no, we haven't gotten any dollars for that.
Okay. I'm sorry. So this was my final question. And because one of the things I was totally excited about when I heard about WCAC was you were looking at policy for data sharing, but that was something that you were unable to get to. Wanted to find out whether or not this behavioral health initiative, is that your way of trying to still address maybe some of those points that you're trying to collect from the data sharing?
Well, the data sharing, you might recall that was one of the key recommendations from the CDC, because when the CDC did its study, it established a predictive model. What it did was it took data from a number of sources: hospital data, data that came from the Children's Department, data that came from the Department of Health and Social Services, from the juvenile justice system. And with all of that data, it was able to look at common features across the 500 and some individuals who are part of their study. And those common features allow them to build this model that would allow for the state to be able to predict who are the folks most likely, to be vulnerable to engaging in serious crime. And due to regulations, mostly at the federal level, about the sharing of data, we couldn't overcome that hurdle. So that slowed us down on that. But we were determined to make whatever contributions we could to our children, starting with stuff that we could do. And this whole area of trying to address trauma, those things that really, really harm our kids. Our kids are, when folks look at our kids getting into difficulties, it's like, they're just viewed as bad kids and not kids who've been put in very bad circumstances and need some support to overcome those bad circumstances. And so that's what we're doing. That's what we're doing with regard to all of the work around trauma.
Thank you so much for your presentation. I'm going to allow Councilwoman Harley to ask her question.
Okay, thank you, Madam Chair. So Dr. Henry, this was a very good presentation, and I can definitely see the growth of the handprint of the footprint of the WCAC. So two things. One, for it to be a advisory council versus one that actually provides services. So is the overall objective to continue to build capacity to be able to get the funding that is needed to continue to provide services for these organizations?
Yes, we will focus very heavily on providing support to those organizations. I personally have no interest in having a lot of funding just available to the WCAC. The only funding that's really needed for the WCAC essentially is funding that would go for the operational support provided by Dr. Angelette's organization, GBA Consulting. And then now that we're a 501c3, we've got dollars associated with the accounting work. It's not a whole lot of money, but the accounting work, the filing of the 990 tax forms and stuff like that. But the bulk of any funding that's raised by the WCAC would be directed to organizations in the community.
Yeah, no, I get that. I was just, I guess my question was, is the goal to continue to build capacity to be able to get more funding? That was pretty
Yes,
much.
exactly.
Okay.
Exactly.
Yeah, because clearly I can see that your reach is going further and further and further, in terms of other organizations and networks, which I think is great. So I was just thinking, you are council and you're not providing services. So it's like, what is the objective? And I think that's a good objective, to continue to network, to build capacity, to be able to get, more funding and grants and et cetera, to help those organizations, because I would think that one of your your observations is that a lot of these programs out there, these grassroots programs are out there, but they lack funding, right?
Yeah.
Absolutely.
Yeah, they lack funding. So with a council such as this one, building capacity with all these organizations, you're able to be that, that muscle, I would think, to help them, as you have shared in this presentation. When I look at CIT, or when I look at Network Connect, I think that's what it's called.
Yes.
Yeah, so I can just, I'm just saying, I commend the council for the work that you're doing in terms of how I can see those organizations that you're working with, how you're building, helping them to build capacity. And I think that's great. I can definitely see the growth from the first time that you did your presentation and the different organizations that you were working with then versus the organizations that you're working with now.
That is the goal. That's our target. It's to strengthen community organizations to get this work done.
And that's great. And then my other point that I wanted to bring up, when you were sharing about the work that I've done speak for me, and you were underscoring the organizations where you get funding from. So I know Wilmington City Council has helped, in different capacities. So is that buried somewhere else, or would that be a bullet on that chart, just showing where, we have been supportive, of the WCAC as well?
Believe it or not, that thought hit me just as I completed that. I said, an unfortunate oversight is I did not include on that chart the support that we've gotten over these past 4 years from the Wilmington City Council. So that is an oversight, and in any future presentation that I make, that oversight will be corrected.
Thank you. Yeah, I just, want it to be highlighted, because, we have been, number one, I think we have been supporting at least since 2017, right?
Yep, absolutely.
Okay. All right. Well, thank you. And again, great presentation. And I think it's pretty awesome to see, how those dollars are being put to work in terms of how you're growing and how you're extending your network and your reach. So thank you.
Thank you.
Thank you so much.
Council Chair.
Actually, Councilman,
My hand was up.
Look, where? I'm like, I've had Councilman Gray's right after Harley's, and then Fields. I'm like, so
Okay,
you can
I go last.
right. Yeah, okay, you can go right after Councilman Fields. Councilwoman Gray.
Yes, I'd like to thank you for the presentation. And at one point in my life, I was a magistrate judge that took care of truancy court, and I saw a lot of traumatized young kids, traumatized students, partially the reason that they weren't in school. But I was going to bring up truancy officers, but kids are not back in school yet, so that'll save for later. But one of my, also I was going to address the data collection. Another reason that failed was I think the feds and maybe the state thought it was too close to profiling, which is a big issue in criminal justice. And anytime you do a scenario that identifies a specific person, especially since it was going to turn out probably to be a Black or brown person, that is right there profiling. I agree with it, but it doesn't go across very well. But something I was going to bring up, and maybe this is just for discussion, all these programs are focused on helping our youth get jobs, and understand that's important to try to quell this violence. But what about all the adults that don't have jobs during COVID? I mean, we're really putting this effort and push toward employing our young. But at this point with COVID and the pandemic, we have many more adults that don't have jobs and needs jobs. So how is this going to be balanced?
Well, when we're talking about the issues, confronting our community, the city of Wilmington, or any other community, you really need a collective impact approach. The Wilmington Community Advisory Council is a very small organization. Right now, in fact, the staff work is, over the past year, it's been Dr. Angela, myself, along with the young lady, Wanja Tuku. And so our priority focus has been on young people, but you're absolutely correct. More attention needs to be placed on those individuals who are the parents of or are caretakers of these young people. More needs to be invested there. It's just beyond the scope and the wherewithal of the WCAC to take that on with any degree of success at this point.
I think that the closest that we're getting to it right now is through the Community Wellbeing Ambassador Initiative with the 24 ambassadors that will be hired. These are good jobs, that are out, and the idea is to help those people to, be paid for the time that they're spending to help in the community, and then to be able to prepare them, build their capacity to be able to move into other healthcare careers, other careers in school, things that based on their interests. So we're not able to do everything, but what we are trying to do is to see where there are opportunities to leverage resources to help create jobs. At the same time, we're building community capacity. We are on it. That is part of the thinking that goes into when we look for opportunities.
Just to underscore that point. With this new initiative, there will be 26 residents of Wilmington employed. All of those will be adults, but in terms of the need, it's just really touching the service. They really needs to be much more investment with regard to the employment needs of our communities. I'm talking Black and Brown communities here in the city of Wilmington.
Thank you very much. Let me see, who is it? Councilwoman Fields, did you have a question?
I did have a question, and maybe he mentioned it before. Thank you, Madam Chair.
Mhm.
My question is, do you have a list of other community organizations and or community centers that you all have worked with other than Network Connect?
Oh, yeah.
We've got a list, and we will be happy to send you. It's a pretty extensive list, and we'll be more than happy to make sure you get that list.
Okay, and the programs that were there, whatever programs you had and where they were, right? You'll have that list. I'm sorry, let me rephrase it. So not just the place, not just the community center or the organization, but what part they played in WCAC. Like you had 140, what was that? I'm sorry.
Well, we had 60 partners.
Right, you have 160 partners. So out of that out of those partners, were 50 of them at William Hicks Anderson Community Center, were another 20 at LACC Hilltop. Like that's my question. Like where are they placed throughout the city of Wilmington?
We work with organizations. We don't work with programs necessarily, and so we can give you a list of the different partners that we have worked with over this period of time, and there are about 60 of them. Okay. Thank
you.
You're welcome.
And we will send that list to you.
Thanks.
All right, thank you. And Councilwoman Oliver, did you have a question?
No, I'd just like to make a statement. First, I'd like to thank you, Madam Chair, for bringing on this tremendous panel tonight. But I just wanted to say, I think I would be remiss if I didn't acknowledge our former president's vision and working with the, as Councilman Harley stated so well tonight, working with the WCAC. Through that, Wilmington was acknowledged for our CDC work. And with that, working, and Wilmington was acknowledged for a trauma state. And I want to emphasize this. Because of this, the governor, Newcastle County, and the Wilmington has profited and I don't mean profit in a good way. I'm just saying they were able to receive a lot of funding from the feds, what they are still receiving, because it has been acknowledged that Wilmington is a trauma state, and a lot of this was the work that the WCAC has done. So I really like to, I mean, y'all really, you know, I really like to give y'all kudos. And as Councilman Harley stated, y'all don't really go for a lot of money, because I've talked to Darrell Chambers and Senator Brown talking about the bills that y'all have helped him with down in Dover. Y'all don't even ask for a lot of money, but y'all do all the research and all the advisory. And I mean, I just like to say, you know, as a community, we are still impact a lot with this trauma. And I'm glad our current council president, Councilman Trippy Congo, has, you know, picked up the torch and is still working with y'all and to continue working with y'all, because our state and our city, we have a lot of trauma in it. So I like to give kudos to Councilman Congo for really working with y'all, and just thanks for the information. And education and knowledge is knowledge, and knowledge is power. So I'd just like to thank y'all, and y'all have a good evening.
Thank you. Thank you.
Thank you very much, Councilwoman Oliver. Council President Congo.
Yes, thank you, Madam Chair. Again, I just want to, you know, echo the sentiments of my colleagues. I want to thank you, Dr. Smith, and thank you, Dr. Angelette, for all the work that you have done for the city of Wilmington. And I just wanted the new council members to have a chance to hear firsthand of the good work that you and your team that you have done for our city. So I want to thank you again, Madam Chair, for allowing this to be on your agenda. I also wanted some of our new staff to be able to hear, what your organization has done. So again, thank you so much, and we look forward to continuing to work with you.
Thank you.
Thank you.
Thank you so much. So if there aren't any more questions from council, I can check to see whether or not anyone is in our audience has any questions. No, doesn't seem to, no hands are raised in our audience.
Madam Chair, just one point. We deeply appreciate your convening this special meeting of the council to hear this presentation and to talk with us this evening. That means an awful lot to us. Thank you.
You're welcome. Yeah, I definitely was trying to make this my first one in February, but how can I say no to you guys? I'm like, I worked with you such a long time. All right, so as I stated, there aren't any more questions. I just wanted to make certain that people were aware that this is just a presentation. There's no voting going on. And that will be it. Then we can actually adjourn this meeting if I can get a motion to adjourn. In a second?
Moved.
Second.
A motion, a second, okay.
The motion has been motion and seconded, and so we can adjourn this meeting. I thank you so much, City of Wilmington, for coming out to listen to more about what we're trying to get accomplished with the the Wilmington Community Advisory Council. You have a great evening.
Thank you.
Great job, Madam Chair.
Bye-bye.